right, the waiting room's still kind of moving pretty quick, so I'm going to leave it open a little bit longer for folks to keep joining. But we can start introducing ourselves as well. So I'm Beth Bordeaux, and we are Partners for Impact, and we work alongside Early Years and supporting this project, this young child homelessness outreach project in North Carolina. My colleagues who are joining us today are Charlene Reiss, who's the evaluator on our project, and Melonie Clarke, who is one of our outreach consultants working in a local community in North Carolina doing outreach. And Partners for Impact is a small consulting firm. We have deep experience working in the homeless service space and also working in various different human service areas. Our primary focus is around systems change. You know, we really want to dive into initiatives and the kind of work that's really moving the needle at the whole systems level. So we may be working with individual organizations and at different levels of the system, but we always have that system lens in mind as we're doing the work. So for anyone who has not already introduced yourself, please, as you can see in the chat, as you're coming into the room, please go ahead and introduce yourself, your name, your agency, where you're coming from. Bladen County, I see someone from Bladen County. I love that. My family is from Bladen County. So y'all are my people. That's excellent. So go ahead and please introduce yourself in the chat. Let us know who you are, where you're coming from, what agency you're working with, and then we will continue. So let's kind of move on. We're going to dive on in now as folks are coming on in. It looks like the waiting room is cleared out. There may be a few folks that continue to join, but let's go ahead and get going. So today's webinar, we're focusing on systems change. So we want to begin with talking to you a little bit about the Young Child Homelessness Project. And many of you may have already been familiar with the project, but we want to give you a little outline on what the project is and what we're doing in North Carolina. And then also, we want to increase folks' understanding of systems and the reasons to work towards change at the systems level. We hope that as we're talking today, that this will cause you to start interrogating all the systems around you, that everywhere you look, you're going to start seeing things in systems now after this conversation. So that's our hope for you. And then we want to also introduce specifically an area of intervention around systems change, and that would be the cross-sector integration work that we're doing here in this outreach project, but also as a leverage point for creating change and creating better systems to address young child homelessness. So those are our objectives today. And we do this work because we believe that every child deserves to have positive childhood experiences. That's the whole why behind this project, that every child deserves to have positive childhood experiences. And the more positive childhood experiences a child has, the more likely they are to be healthy and resilient. We know that children experiencing homelessness are also likely to experience trauma, and these positive experiences are what's going to really shift and help them build that resilience and build the stability that they need. So that's where our focus is. And, you know, in addition, we're doing this because we know there's just too many children that are experiencing homelessness in North Carolina. The next slide, please. So we have more than 40,000 children in North Carolina experiencing homelessness, according to some of our latest statistics. And, you know, we're actually, that's across the whole spectrum of children. We're learning from public school data. So it's just too much, right? And we need to be addressing it in every way that we can. Next slide. So we're addressing it through the Young Child Homelessness Outreach Project. Again, this is a project that's funded by the Division of Child Development and Early Education, DCDEE, with the state of North Carolina. They're granting the funds to Early Years, and Early Years is contracted with us for a large component of the implementation. The impact we're trying to make is for children and families that are experiencing homelessness, that they have those positive childhood experiences. And our model for doing this is to connect families to high quality childcare and childcare subsidies through a community outreach and enhanced referral services. So there's two kind of big components to this. There's the local outreach component, and then there's a statewide outreach component. And we're going to talk a little bit about both of those. So next slide, please. Our local outreach approach is to help connect families to child care resource and referral. And through that connection, they will also be connected to high quality child care, and they'll be connected to subsidy dollars. We know that there are opportunities within the subsidy system to help specifically for families that are experiencing homelessness. So they may be able to access those dollars, and that might not be, widely known. So we want to get that word out. And then the child care resource and referral in the communities where we're doing local outreach is actually doing a enhanced service, like a maybe child care navigation type service within the child care resource and referral to ensure that families have access to the high quality child care that they need. For the other element of this is we're reaching families and we're getting the information out to families through strategic partnerships, through working with those local agencies that already have relationships with families. So instead of trying to connect directly with families, we're outside of communities. We're coming into communities and helping to bring this information to the local agencies that already have relationships with the families in their community. Places like shelters, DSS, schools, libraries, even food pantries, and other crisis support organizations. Next slide, please. In addition to that, once we've had conversations and we've met with a number of these local partners, we're doing a convening where we bring those partners together, building those connections across partners and across the sectors, and brainstorming on solutions for local communities to help bridge the gaps. We will be gathering information and understanding more about what's going on with families and what some of the challenges are. So we want to give opportunities for communities to actually create solutions to those challenges. Next slide. And then finally, with our statewide outreach, there's a statewide newsletter, and there's a link in here, and you're going to all get access to these slides. So follow up on that link and sign up for the newsletter if you haven't already. It very well may be how you learned about this webinar is because you're already on our newsletter. So we're sending information out through the statewide newsletter. And we're also doing webinars like this in order to connect with as many people as possible across the state and let you know about this project. Next slide. Now I am going to hand it over to Melonie, who is going to share with you more specifically about the systems change work that we're going to talk about today.
Thank you, Beth. So now that we've talked a bit about the outreach project and our why, let's talk about systems change and the value that we see in this approach when it comes to addressing young child homelessness. Next slide, please. So we're going to start off with some definitions, and I want to preface this by saying that the definitions we're using today are for the purposes of this webinar. If you do a Google search or if you review some other source, you may get a slightly definition. but we're going to lay the groundwork for what we're going to be discussing today. So we're defining a system as a set of parts coming together for a specific purpose. And there are as many systems as there are purposes. So systems vary in size and complexity. They can be as small as a nuclear family and as large as a country. So as we get started thinking about this, we'd like to hear from you. So we're going to ask you to let us know in the chat, if we center the child and the family and we add support as the purpose for the system, what are some examples of the parts that make up the child and family support system? So we're going to give you a few minutes. Let us know in the chat if you think about the system that supports a child and their family, what comes to mind as some of the organizations, groups, people that make up that child and family support system. And I'm just going to ask Charlene to.
Yeah. So we're getting some answers. Education, child care resource and referral, child care, faith-based communities, work entities for parents, high quality child care, the educational system, school personnel. It's great. Yeah. Keep them coming, folks. Relatives, friends and extended family, healthcare. Yeah. Work, child care.
Great. So these groups, people, organizations, all work together to support the well-being of the child and the family. Next slide, please. So now that we're on the same page about system, let's talk about sectors. So sectors tend to exist within larger systems. So we can think of them as systems within systems. And they tend to focus on a specific issue area. So again, using even some of the examples that you mentioned with the child and family support system as an example, some of the sectors that exist there are healthcare, early childhood education, K through 12 education, affordable housing, social systems, social services, and the list goes on and on. So we're starting to see how vast and complex systems can be. Next slide, please. And finally, we have the ecosystem, which is often a larger system that includes many different systems and sectors with different purposes and focus areas. And what connects them is what is at the center. So if we keep going with our example of the child and family at the center, the ecosystem includes the whole environment around that family. And that means that there are systems and sectors within that ecosystem that have both direct and indirect influences. And so as we talked about some of the systems that have direct influences, right, extended family, the pediatrician's office, we can talk about parks and recreation, all of those things. When we talked about those direct influences, we can also think about indirect influences, which include the cultural context surrounding the family, a parent's workplace policies, government policies that impact education or social services. Next slide, please. So now that we understand systems, what do we mean by systems change? So we're talking about an approach to addressing the root cause of a problem by changing policies, practices, resource flows, relationships, and mindsets so that a system produces better outcomes for everyone it serves. And as we've already seen, systems can be complex And so, of course, systems change work can also be complex. So today we're going to focus on one specific, what we call leverage point, and we're calling that cross-sector integration. And this can be a very powerful leverage point when we think about tackling young child homelessness. So I'll hand it over to Charlene to talk more about that.
Great, thank you. So next slide. So as Melonie just said, the systems change is very complex. Systems are very complex, and there's many, many levels of systems, and therefore many levels of systems change. There's many different ways to approach it. And what we want to talk about today is how the Young Child Homelessness Outreach Project is approaching systems change through cross-sector integration. Next slide, please. So when we say cross-sector integration, let's start with the status quo. So what we know from working in communities and from our work experience and from talking to many of you who are on this call and your colleagues in communities, what we encounter repeatedly is that agencies are working in silos. So meaning everybody's doing their piece of the work. Hopefully, they're doing it well. They're doing it to the best of their ability. And they're not necessarily talking to the folks who are doing other pieces of the work to support families experiencing homelessness. For example, the folks in food security may or may not be talking to the folks in childcare, in the childcare sector, or the folks in the homelessness sector may or may not be talking to the transportation sector. So why is that? There's many, many reasons. And what happens is that often staff only have time to know what they do. So in a under-resourced world that social services and all of these services are often performing in, there's only so much time. Everybody's overstretched, and folks don't have time to look outside of their immediate group of contacts and find the right people in other agencies who can help their clients. Most of those cross-sector relationships that do exist are at the resource and referral level, meaning you know somebody or you know that agency, and so you refer that your client to that agency, maybe with a warm handoff, maybe it's a phone number, but it's not necessarily an integrated approach to serving the client. It's more of a referral to another system. It's like go out this door and go into another door. Go out of this building and go into another building. That it's not an integrated system. What this means is that families must navigate each of these sectors, each of these services separately. And because, as we know, families come for services, they don't usually come for just one thing. Or they may come to your service for one thing, but they have many other needs in their lives. They may need housing, employment, transportation, childcare, healthcare, mental health care. But usually what's happening is they have to go to a different agency for each one of those services, fill out new paperwork every time, tell their story every time. And it's a heavy lift for families. Next slide, please. So when these systems or these sectors are really separate and siloed, what happens is it creates a lot of challenges. And it creates challenges for the families who are trying to navigate those different sectors, and get different services. And it also creates challenges for the people serving in those sectors, for the frontline staff who are trying to do the work. So, for example, information may not be flowing from one agency to another. One example that from our work in communities may be that shelter staff at a homeless shelter that's serving families don't have a current connection with their social services agency, their social services office. And the information that they have about child care subsidy has been passed down to the workers from previous workers. And in previous years, there was a long wait list. Families never got subsidy. And so that's the information that they have now. But in fact, things have changed over the years, and there are subsidies available, but the shelter staff never gets that information, so they're not sending anybody over to DSS to get the subsidy because their information is old. So that's one example of what happens when they're operating separately. There's no connection between them. Another example is when policies in one agency are basically formed, the policies and practices are formed when with only the knowledge of that sector. So, for example, there's child care agencies that may have policies and practices around paperwork, around attendance, around what the family needs to contribute that really work well for families who are housed and have resources, but don't work at all for families who do not have stable housing and may be living in a shelter, living in their car, living in a hotel or a motel. And so because that child care center doesn't have any connection to the homelessness sector, they don't really have a good sense of what it means to really support all the families in their care, including those experiencing homelessness. So in the chat, I can see that things are going. I'm not reading them, but I'm sure all of you have some examples, and please share them in the chat of ways that not having connections and integration with other sectors really affects the work that you're doing as you serve families. Next slide, please. So I think I saw this go by in the chat. So other examples are connections are personal relationship specific. So meaning that often a staff member at one agency has a personal relationship with another staff member. They met them at a conference or they met them at a meeting. They exchanged phone numbers. They know each other, but it's not really institutionalized. And so when either person leaves their position, that relationship between the agencies goes away. Nobody knows who that person was, who replaced them, how to get to that agency because the one person that somebody knew has left. Another challenge that I alluded to earlier is when staffing resources are limited. So what we have found talking to the frontline staff particularly is that caseworkers are stretched really thin. And they're really trying, the caseworkers we've met, they're really trying to meet all the needs of families with really limited resources. It's not necessarily what their agencies do to solve, to address all the needs. And they don't have the time to look around, and cultivate connections with other organizations. They don't have the time to figure out who at these other agencies does the services, provides the services that these families need. And so caseworkers are feeling isolated, they're feeling stretched, and they get burnt out because they're trying to solve a lot of problems that they don't necessarily have the resources for within their single agency. Next slide, please. So we want to really hit home that these examples are not about individual failings. So when we talk about those challenges, it's not because of those individual staff members failing at something, or even the management of the organizations failing at something. It's not about the families not doing what they're supposed to be doing. These are system level barriers where there's not systemic structures put into place to address the complex needs that families have, and to best create a system that centers the families and is created to address the realities of working with families with complex needs. And every family has complex needs. So when we talk about systems change, we're really talking about systems level change, changing the system, because individual change is not going to change the system level problem. So giving families, more information about how to budget, or how to giving each individual family information about how to sign a lease is not going to solve a systemic problem around how much housing there is, for example. Beth, do you want to give any of the examples that are popping up in the chat?
I was just going to dive in. We have a couple. One is, a reiteration of when you have staff changes because of the relationships, and that so much of the work of human services is based in relationship. That, when you get a good connection and that connection works for the families that you're working with, and I've, been a social worker, been a frontline case manager, in several spaces. And I remember, if you have that connection and that connection works for families, then you just want to keep bringing that connection over and over again to every family that you're working with, right? If they have that need. But then when something breaks that connection, right? Either staff member leaves or something breaks that connection, it's hard to rebuild it. It's hard to figure out where to go for the next connection around that particular thing. So that's being identified here in the chat. And also the challenge of when parents and families feel like getting the support is daunting. Their challenges are so complex. Accessing the support they need is daunting. It's hard work to go through system after system and try to find those resources that you need. And it's extremely complicated to have to hit each one individually. And then, can you imagine if you're taking the bus and you're having to get to all of these various different places at different times, and you miss that one, and it's very complicated. So people are just acknowledging some of those challenges and complications for families when systems are not integrated well.
Great.
And especially when there's so many stipulations on the help that they're seeking, right?
Right.
When there's so many, I have to have this piece of paperwork for this one. I have to have that piece of paperwork for that one. And I have to qualify in this way here, but I qualify differently over here. And then trying to figure out what all those qualifications are, and having all the right information for the right service provider. Yeah. And
we've talked, our group has talked about the benefits cliff, people who are turning down promotions or jobs because if they make too much money, they're going to lose their benefits in other ways, and it'll end up putting them in the hole. And they'll actually have fewer resources if they get a better job.
So this whole conversation about systems change, right? You guys are starting to hit it, right? Y'all are starting to hit it, that the whole point of shifting systems is to be more focused on centering the family, right? On really centering what that family needs, and having our systems be more integrated across the different types of work we do, so that the pathways for families to access the resources they need are simpler.
and center the families instead of the system. Okay, let's go on to the next slide. Thanks, Beth, for bringing those in. So why integrate sectors to change systems? I think we've started to hit on, because the siloed systems siloed sectors are not working for families, and they're not working for the providers. So cross-sector integration breaks down those silos, and it tries to build pathways for the sectors to work together to make it easier for families to get their needs met, and for providers to meet the needs of families. So for families, one of the things that we really talk about when we talk about systems change is systems change shifts the burden of change off of the families onto the system while increasing access to services. One of our colleagues would say, we're not trying to fix families. So to address these problems that we're talking about, these challenges, trying to fix families is not going to change the system, and it's not going to make better outcomes for all families if we're trying to change families one family at a time and change family behavior. What we're really talking about is shifting the burden to change the system so that families have better options. Often the choices that families make are based on the options that they have, and the system really limits them to options that are not best for their family. So we want to create a better system that creates better options so families can have the best outcomes. In doing that, it benefits providers as well, because when we're talking about providers burning out because they're trying to do everything by themselves, it really broadens the pool of people who are helping, they're working together. Individual caseworkers can call on others in other sectors, in other agencies for help, and they don't need to know everything. They can be the expert on their own area, and they can feel confident that they can hand a family, they can make a warm handoff of a family to another expert in another area, and they know that work will be done. Or the caseworkers are working together so that they can look at how some of the systems kind of are at cross purposes, and they can find creative solutions together to help families. And they're not trying to solve all these problems by themselves, which, as we know, is really exhausting. Next slide, please. So some examples of why sector integration is important. As I was just saying, it really centers the family. So often, so many of our systems are centering the system or the agency. The way things are set up is the most efficient, the most cost-effective. It's easiest for the system. But what that looks like is that families are forced to manage many different systems that are not designed with their best outcome in mind. They're designed with the best outcome for the agencies in mind. And each agency is doing its own thing. So when it's integrated, we're working to create a system that looks at the needs of the family and centers the family, and then creates a system around that. Creates a system, a cross-sector integrated system that really addresses what's in the best interest of the families. Okay, let's design our system and our work and our services, our policies and our practices around what's in the best interest of families. How are we going to get the best outcome for families and children? Next slide, please. What we know is that families have, as we said earlier, families have really complex needs. It's not just families don't have just one need. They have interrelated needs. And so when the systems are siloed, those needs, it's kind of been brought up in the chat, those services are often competing around what families have to do and what they require of families. Sometimes it's often redundant, right? They're filling out the same paperwork over and over again. They're telling their story to people over and over again. Or sometimes the needs compete for the agencies, where if to qualify for one service, it'll disqualify you from another service. So integration, what we are working towards is where the sectors are working together so that families are being served by a team, and they're getting all their needs met by a team that's working together, looking at the whole picture of what the family needs and finding creative solutions across all the needs so that it's easier for families and the outcome is better for families. Next slide, please. And the cross-sector integration, kind of what Beth was talking about, is built on building relationships. What we know from protective factors science is that connections are a protective factor that builds resilience. And that protective factor is true for small children, for babies and small children, having connections to the families, having connections and a network of support, but also to providers and the agencies having connections. That it builds resilience into the agencies and the system and the work when there's more relationships and stronger connections between agencies. So when it's siloed, as we said, agency staff are trying to solve all the problems and they're burning out. When it's integrated, they have partners. Agency staff have partners they can rely on. They can look to other service providers to help them find solutions, and they're not working by themselves. Next slide, please. So just a few examples of cross-sector integration, and please feel free to put some more of these in the chat from your own experience. I know, looking at who's on our call, I know some of you are doing really great work in your communities, integrating your services across agencies, so please feel free to share in the chat. Some examples are, for example, the libraries where they have a social worker from their local social services office sitting at the library so that the families coming into the library can actually meet a DSS social worker and don't have to go to a whole another building, maybe across town. A medical clinic might be providing space for other resources that families need, like food. So they're partnering with the local food bank to have a food pantry on site. They're partnering with the local diaper bank to have diapers and hygiene supplies on site at the medical clinic where the family is going anyway. They might have someone who comes over regularly and provides early childhood developmental assessments, and that's on site where a pediatrician might see a family and recommend that child gets an assessment instead of having to send the child and the family to a whole nother building, make an appointment, navigate a whole other system. That provider is actually in the building and can work directly with the family through the service that they're already receiving. Another example is a public high school that has on-site childcare for teens who are parenting and works with the local Partnership for Children to provide parenting support and parenting classes on site for teen parents who are trying to finish their high school degrees. So it's not so much that the public high school has to figure out how to provide the parenting support. They're partnering with the agency that's the expert in that. Another simpler example from one of our communities is a summer meals program that is sending home a flyer with every child who comes for a summer meal, sending home flyer about the child care resource and referral services in their community, so that families, they're reaching more families about that information to access the child care resources and other parenting and family resources and subsidy resources that the CCR&R agency in that community is providing.
Charlene, we have a bunch of comments.
Okay.
So one, folks are just kind of identifying several different great examples of cross-sector integration, like case conferencing, funding case managers and agencies to actually attend these case conferences, right? Partnering with like shelter programs and various programs, partnering with other organizations like Triple P or Positive Parenting Program, right? So having various different kinds of programs integrating and working together in the same space or with the same group of people. Childcare plus healthcare, like how do you cross over childcare and healthcare? Having a nurse visit childcare centers, right? Whatever. There's lots of really creative ideas around this. Can
I just make a comment to one of the, reply to one of the comments about, so going back to the comment about it's not an individual failing, it's a systemic failing. And there's a comment about resources and funding. And it is absolutely true that often the way that our systems are created and our sectors, our services are created is because of what the funding will allow, how much funding there is, the restrictions around the funding. And so even when staff have the best intentions, there's these parameters that they have to work within. It's a whole nother webinar about addressing that level of the system, because what we know is that is a systemic level issue, is how much funding and how many resources are available and what are the rules around that funding. So yes, 100% that is true, that that funding and those parameters really drive so much of the way our systems are designed. And if I had my way, we would have spent this whole hour just talking about how to actually address systems change at that level. Maybe we'll do another webinar about that, because that is, I think, as we're looking at this, I think you people hopefully are really realizing, we're working within a larger system that's impacting how we work at our level. And in order to really get even deeper into those root causes, we have to go higher up in the system and really address those changes. And that's really where advocacy becomes a really important tool around advocacy to policymakers who are making those decisions around funding, around who the money can go to, around how the money can be spent. So 100% I agree, and really want to hit on we are not in any way trying to say that agencies aren't doing their best. What we understand is they're doing their best within the system that has been created at a higher level.
Yeah, Melonie mentioned when she was kind of going through some of the sort of definitions about leverage points. And we are talking about cross-system integration as one tool, one leverage point. There are many, many leverage points for how to make systems change, and many layers within a system where you can start addressing change. We often do with some of our clients, we do a system mapping process where we spend a lot of time kind of visually drawing out the system and where the relationships are and helping to identify what those key leverage points are in a particular community so that we can, elevate that and find solutions in that space. And a leverage point is any place where you can make an intervention happen and it will create a ripple effect around the system of impact, right? It's not just impacting one little thing or the very thing that you're addressing. It's also going to have a ripple effect. And this whole idea around addressing the needs, addressing the funding systems in order to address the service system that's a key leverage point where there's major ripple effect, right? So, yeah, it's just kind of highlighting some of the language we've been using in what you're saying.
For sure.
Yeah.
Okay, you want to keep going, Beth?
Yeah, let's do. Yeah. So let's pop to the next slide. So I wanted to just talk a little bit about some of the work that we're doing with the outreach project. And I hinted at this at the beginning. I kind of introduced it slightly as I talked about the various different elements of the outreach project. But in local communities, we are working on this cross-sector integration within this project in some particular ways. So I want to kind of highlight those. Let's hit the next slide, please. So we are building these connections in communities first by just learning from local providers. The very first thing we do in a community where we're doing local outreach is we meet with various providers. Someone from Department of Social Services, definitely want to talk with folks in the subsidy system. We want to talk with McKinney-Vento social workers and liaisons within the school system. We want to talk with some folks within the homeless service system, family shelter folks, coordinated entry folks. We want to talk with people within the early childhood system, maybe early intervention. We've attended some of the local interagency coordinating council meetings. Those kinds of conversations. We have many conversations across the community as soon as we enter into a community. We are introducing the project, but we're also listening. We're listening and trying to glean an understanding of what is going on in this particular community. Where are families meeting challenges? Where are service providers meeting challenges? And particularly, we're looking at that space of crossing early childhood with homeless services, right? And even more specifically for this project, we're paying attention to how are families accessing childcare, right? So we're looking kind of broadly, but we're also kind of honing in specifically on that area. And then we're putting together the findings. What did we learn through all those conversations? We're documenting those conversations. Then we analyze that data from those documented conversations, and we put together the findings in a report. And we put that report back out into the community, sharing it with all the people that we had conversations with first, right? So we share it first with those folks. We're sharing it with the local child care resource and referral organization, and anybody else who was a participant in our conversations. And then we're working with that local child care resource and referral organization to host and create a cross-sector gathering where we will then facilitate some conversation. We'll go through some of those findings that we have in the report, and we'll facilitate a conversation among community members. Now, at that meeting, we're typically inviting all of the people who have participated thus far, who we've been having conversations with, but also others. So, anyone else that folks feel like need to come in the local community. It's your community, so we don't really know who the players are. So we're asking those who we've already had conversations with, who else needs to be at this table that we need to have this conversation with. And we've had some communities where we have, town managers or elected officials at those meetings, as well as a wide array of service providers and funders who have come to those meetings. And in that setting, we spend some time in small groups really kind of fleshing out some creative ideas around what are those leverage points, right? What are you seeing in our system when we try to cross this early childhood space with this homeless service space, and when we try to really elevate the needs of young children who are experiencing homelessness, who often get overlooked across this system because there's so much focus and energy from our funders in our homeless service system to focus on housing, to focus on income generation, that we don't always put the focus on the child. So we try to create that focus point in these meetings. And then we summarize what we learn and what the recommendations are from the community, from the local community, from those conversations. And we add that to the report. So now we have a full report that gives you our learnings from all these conversations we've had across the community, plus the recommendations that have come out of this cross-sector meeting that we share back with the community. Next slide, please. Just a few of the things, and we don't have a ton of time, but a few of the things that we've heard from communities, ideas, solutions that folks have come up with, creating some kind of child care gap funding or temporary solution as a family is seeking subsidy or trying to get their child into a more permanent child care solution. So sometimes they're on waiting lists. Sometimes it just takes a long time to get all that eligibility paperwork. Now, this is not a root cause fix, right? I want to be clear about that. A root cause fix would be changing those policies so that people don't maybe have to come up with quite so much. But we can still create some solution in a community by creating some gap funding and ensure that families do have quick access to child care. Also, like sharing these resources at various different events. So making sure that folks across the community know about the 4% child care subsidy when children are experiencing homelessness. If you meet, the McKinney-Vento, so it's a kind of a broad definition of what homelessness looks like, then you can, and recognizing that families don't always self-identify as that, but understanding what that qualification looks like so that folks can get access to that set aside dollars. So these are some of the local solutions that folks have come up with. Let's go to the next slide, please. The key components for systems change. So just like kind of all of the things that we've been pulling together here. I just kind of want to wrap it up in this one slide. Centering the children and the families, right? That is the most important thing. If we think about our systems from the perspective of the children and family, really, then I think we would change a lot of the way we do things. And we can't do that without listening. Really elevating the voices of those who have actual experience, lived experience in that space, have faced those challenges themselves and know what they need, right? And just listening to that. And when you center them and you listen to them and you hear what then working collaboratively with families in order to build the things that they need in our systems. Including these relationships that cross agencies and facilitating the relationships between people. Data sharing and transparency, like really being able to share information and ensuring the community ownership of information, ideas, and action. So again, the community, the collective community needs to own the action. And the ideas. So what we come up with, and as the teams develop recommendations, and we just put it in a report, we're the facilitators to help make it happen, but we give that report back to the community. And it's really up to the community to say, how are we going to make this live forward? There is, I will say, a need for next elements of this. Right now, we're just in year 2 of this pilot project. And there's absolutely a need for, okay, then what, right? How do we bring our funders together around some of the initiatives that communities come up with that solve issues? How do we do that work? So there's absolutely next steps. And that will be, hopefully what we get to talk about in a future webinar is like, where do we go from here? But first we have to just identify what are these challenges in our systems, bring those people together and figure out how we're going to move forward with it. Next slide, please. I see a lot in the chat. Is there anything, I know we're running tight on time now, anything that we need to highlight or address, Charlene?
There's no questions. There's just a lot of really great comments, and we will may follow up with some of those in our newsletter. Yeah, really great ideas. And
this is a great place to share information with us that we can highlight in our newsletter. That's a great point. The next slide, please. I want to share with folks. You'll get this because anybody who signed up for the webinar will send out an email. You'll get You'll get the slides. You'll get the recording. On here is a lot of resources about the project. If you're interested in having this project in your community, then hopefully at the end of this pilot, we'll be able to keep going and we'll expand into new communities. So let us know that you're interested, and we'll keep up with that and be back in touch. Also, I would say fill out the evaluation, please. That is in the chat. I think it's been popped in the chat a couple of times, so please take a look at that. It's very short, really helps us to plan for our next webinar. So thank you all so much for joining us today. It really means a lot that you are doing the work that you do, and we just appreciate you. Thank you.
Thank you all so much for being here.